3 a.m. Another bathroom trip. It's just getting older, you tell yourself. But what if your body is screaming a warning you're choosing to ignore? Every 14 minutes, a man receives a prostate cancer diagnosis. Yet most ignore the whispers that could save their lives. Today, we're revealing 7 silent alarms your body sends before it's too late. Signs so subtle, 8 out of 10 men dismiss them completely. But here's what doctors don't tell you. These minor annoyances can predict your survival odds with startling accuracy. Before we unlock these life-saving secrets together, welcome to our health family. If you're new here, hit that subscribe button and join thousands of men taking control of their health. Give this video a thumbs up if you're ready to become your own health detective, and drop your age in the comments. Let's see who's being proactive about their well-being. Your future self will thank you for the next few minutes. Ready to decode what your body's been trying to tell you? So, what are the signs? Let's begin with the very first one every man over 60 should be aware of. Nighttime bathroom visits multiply. Let's start with something that affects the sleep of millions of men worldwide. Nocturia, or frequent nighttime urination. Now, you might think getting up once or twice during the night is normal as you age, but here's where it gets concerning. Research published in medical journals shows that over 70% of men with prostate cancer report experiencing significant nocturia, typically waking up 3 or more times per night. But why does this happen? Your prostate gland sits right at the base of your bladder, surrounding the urethra like a ring. When prostate cancer develops, or even when the prostate simply enlarges, it can squeeze this vital tube, making it harder for your bladder to empty completely. The result? Your body keeps signaling the need to urinate, even when there's very little left to release. What makes this particularly insidious is how gradually it develops. You might start with 1 extra bathroom visit, then 2, then 3. Each time you rationalize it away. Maybe you drank too much water before bed, maybe it's just stress. But clinical studies have found that men experiencing persistent nocturia are significantly more likely to be diagnosed with prostate issues, including cancer. The key distinction here is persistence and frequency. If you're consistently waking up multiple times every night for several weeks, this isn't just normal aging. Your prostate might be crying out for attention. Sleep disruption from nocturia doesn't just affect your rest. It impacts your immune system, cognitive function, and overall quality of life, creating a cascade of health problems that extend far beyond your prostate. Next, warning sign number 2. The stream struggles to start. Here's a scenario that might sound familiar. You're standing at the toilet, ready to urinate, but nothing happens immediately. You wait, maybe push a little, and finally, after what feels like an eternity, the stream begins. This hesitation, this delay before urination starts, is called urinary hesitancy, and it's far more significant than most men realize. Research from leading cancer centers shows that urinary hesitancy occurs when the prostate gland enlarges enough to narrow the urethra, the tube that carries urine from your bladder. Think of it like trying to drink a thick milkshake through a straw that's been partially pinched. The liquid wants to flow, but the obstruction makes it struggle. What's particularly alarming is how this symptom progresses. Initially, you might experience just a slight delay, maybe a second or 2 longer than usual. But as prostate cancer or enlargement advances, this hesitation becomes more pronounced. You might find yourself standing there for 10, 20, even 30 seconds before the flow begins. Some men describe having to concentrate or strain to initiate urination, which should never be necessary for this basic bodily function. The Mayo Clinic and other prestigious medical institutions emphasize that persistent urinary hesitancy, especially when combined with other symptoms, warrants immediate medical evaluation. The reason is straightforward. Early-stage prostate cancer often manifests through these subtle urinary changes before becoming more aggressive. The tragedy is that many men dismiss these early warnings, attributing them to normal aging when they could be receiving life-saving early intervention. But here's what you need to understand. Normal aging doesn't typically cause significant urinary hesitancy. Yes, things might slow down slightly, but if you're experiencing consistent delays in starting urination, your prostate is likely trying to tell you something important. Next, warning sign number 3. Weak or stop-and-go flow. Imagine turning on a faucet, and instead of a steady stream, you get a weak dribble that starts and stops unpredictably. This is exactly what happens with your urinary stream when prostate cancer begins to interfere with normal function. Medical research consistently identifies weak or interrupted urinary flow as one of the most common early signs of prostate problems. The science behind this is both fascinating and concerning. As cancerous tissue grows within the prostate, or as the gland enlarges from other causes, it creates uneven pressure on the urethra. This doesn't just slow down the flow, it makes it erratic and unpredictable. You might start urinating normally, only to have the stream suddenly weaken to a trickle, stop completely, then restart again. Clinical studies from MD Anderson Cancer Center reveal that this symptom often progresses in stages. Initially, men notice their stream isn't quite as strong as it used to be. They might need to stand closer to the toilet or wait a bit longer to fully empty their bladder. But as the condition advances, the flow becomes increasingly problematic. Some men describe their stream as like a garden hose with poor water pressure, or stopping and starting like a broken sprinkler. What makes this symptom particularly significant is its impact on daily life. A weak, interrupted stream means taking longer in bathrooms, feeling like your bladder isn't completely empty, and experiencing the frustration of frequent, unsatisfying trips to the toilet. But beyond the inconvenience, this symptom represents a mechanical obstruction that's getting progressively worse. The research is clear. Men who experience persistent weak or interrupted urinary flow have a significantly higher likelihood of prostate cancer diagnosis compared to those with normal urinary function. The key word here is persistent. We're not talking about an occasional weak stream after a long day or when you're dehydrated. We're talking about a consistent pattern that develops over weeks or months. Next, warning sign number 4. Stinging or burning sensations. Now we enter territory that many men find particularly uncomfortable to discuss: pain during urination or ejaculation. This burning, stinging sensation isn't just unpleasant. It's your body's alarm system going off, warning you that something is seriously wrong. When prostate cancer develops, it often creates inflammation in the surrounding tissues. This inflammation can irritate nearby nerves and structures, leading to pain that manifests during urination or sexual activity. Medical research shows that this type of discomfort often mimics urinary tract infections, leading many men to delay seeking proper medical evaluation. But here's the crucial difference. While a urinary tract infection typically resolves with antibiotics within a few days, cancer-related inflammation persists. You might take antibiotics and feel temporary relief, only to have the burning sensation return. This pattern of recurring discomfort, especially without the presence of actual bacterial infection, should raise immediate red flags. Clinical studies indicate that approximately 30% of men with prostate cancer experience some form of painful urination or ejaculation during the early stages of the disease. The pain can range from a mild burning sensation to sharp stabbing discomfort, that makes these normal bodily functions genuinely distressing. What's particularly concerning is how this symptom affects intimate relationships and overall quality of life. Men experiencing painful ejaculation often withdraw from sexual activity, not just because of physical discomfort, but because of the anxiety and fear that develops around these experiences. This creates a psychological component that compounds the physical problem. The medical community emphasizes that any persistent burning, stinging, or pain during urination or ejaculation, especially in men over 60, requires thorough urological evaluation. These symptoms don't just indicate local irritation. They can signal inflammatory processes associated with cancerous changes in the prostate tissue. Next, warning sign number 5. Blood shows up in urine or semen. If there's one symptom that should send you straight to a doctor's office, it's the presence of blood in your urine or semen. Even the faintest pink tinge or small streaks of blood represent a serious warning that cannot be ignored. Recent research published in prestigious medical journals reveals that nearly 1 in 5 men who present with unexplained blood in their urine are ultimately diagnosed with prostate cancer. The appearance of blood, medically called hematuria, occurs when cancer disrupts the normal tissue structure of the prostate or surrounding areas. As malignant cells grow and multiply, they can erode small blood vessels, causing bleeding that becomes visible in urine or semen. Sometimes this blood is obvious, bright red or dark brown discoloration that's impossible to miss. Other times, it's subtle, just a slight pink tinge that you might notice only occasionally. What makes this symptom particularly alarming is its unpredictability. You might see blood one day, then not again for weeks, leading you to believe the problem has resolved itself. But research shows that intermittent bleeding is actually characteristic of many prostate cancers. The cancer doesn't bleed constantly. It bleeds when specific tissues are disrupted or when the tumor reaches certain blood vessels. Clinical data from major cancer centers demonstrates that men who experience blood in their urine have approximately a 3% chance of having prostate cancer, with this percentage increasing significantly in men over 60. When blood appears in semen, the statistics become even more concerning, as this typically indicates more direct involvement of prostate tissues. But here's what you absolutely must understand. Blood in urine or semen is never normal at any age. While it can result from infections, kidney stones, or other benign conditions, it can also be the first visible sign of cancer. The only way to determine the cause is through proper medical evaluation, including imaging studies and, potentially, tissue sampling. The tragedy is that many men see blood once or twice, then convince themselves it was just a fluke when it doesn't immediately reappear. They rationalize it away, thinking maybe they exercised too hard or ate something unusual. This delay in seeking medical attention can mean the difference between catching cancer in its early, highly treatable stages versus confronting it after it has had time to advance. Next, warning sign number 6. New onset erectile difficulties. Sexual health problems can be devastating for men, but when erectile dysfunction appears suddenly in men over 60, it might be more than just an aging-related issue. Cutting-edge genetic research has identified a strong connection between prostate cancer and the development of erectile dysfunction, revealing that this isn't just a coincidence. It's often a direct result of cancerous changes affecting blood flow and nerve function. The prostate gland plays a crucial role in sexual function, and cancer can disrupt this in multiple ways. First, malignant tissue can interfere with the blood vessels that supply the penis, reducing the blood flow necessary for achieving and maintaining erections. Second, cancer can affect the delicate nerve pathways that control sexual arousal and response. Large-scale genetic analyses have shown that men with prostate cancer have significantly higher odds of developing erectile dysfunction compared to their healthy counterparts. What makes this symptom particularly challenging is the psychological component. Many men experiencing new erectile difficulties assume it's related to stress, relationship issues, or natural aging. They might try over-the-counter remedies or simply avoid sexual activity rather than seeking medical evaluation. This response is understandable but potentially dangerous if the underlying cause is cancer. Research from leading medical institutions shows that erectile dysfunction can appear months or even years before other prostate cancer symptoms become noticeable. This makes it potentially one of the earliest warning signs, but also one of the most commonly dismissed. The gradual onset can make it seem like a natural progression rather than a medical emergency. Clinical studies reveal that men who develop erectile dysfunction after age 60, particularly those who previously had normal sexual function, should undergo comprehensive prostate evaluation. The relationship between erectile function and prostate health is so strong that many urologists now consider new-onset erectile difficulties a red flag requiring immediate investigation. The good news is that when prostate cancer is caught early, treatment options are available that can address both the cancer and help preserve or restore sexual function. However, this requires recognizing erectile dysfunction as a potential cancer symptom rather than just an inevitable part of aging. Next, warning sign number 7. Achy hips, lower back or pelvic bones. The seventh, and perhaps most ominous warning sign, takes us beyond the prostate itself to a symptom that signals cancer may have begun to spread. Persistent, unexplained bone pain in the hips, lower back, or pelvis. This isn't the occasional ache from sleeping wrong or working in the garden. This is chronic, nagging pain that doesn't respond to rest, over-the-counter pain medications, or typical remedies. Medical research reveals a sobering truth. Prostate cancer has a particular affinity for bone tissue. In fact, bone is the most common site for prostate cancer metastasis, with studies showing that up to 85% of men with advanced prostate cancer develop bone metastases. The reason lies in the unique biological environment of bone tissue, which provides an ideal setting for prostate cancer cells to establish secondary tumors. When prostate cancer spreads to bones, it disrupts the normal balance between bone formation and bone breakdown. This disruption creates inflammation and structural changes that manifest as deep, aching pain. Unlike muscle soreness or joint stiffness, cancer-related bone pain tends to be constant and often worsens at night or during periods of rest. Many men describe it as a deep, gnawing sensation that seems to come from within the bone itself. The most commonly affected areas are the spine, pelvis, and hip bones, essentially the central skeletal structure of the body. Research shows that these areas have rich blood supplies and specific cellular environments that prostate cancer cells find particularly hospitable. The pain often starts in one location, but can gradually spread to adjacent areas as the cancer establishes itself in multiple bone sites. What makes this symptom particularly concerning is its implications for prognosis. When prostate cancer has spread to bones, it indicates that the disease has moved beyond the local stage and entered a more advanced phase. However, even at this stage, effective treatments are available that can control the cancer, manage pain, and maintain quality of life for extended periods. Clinical guidelines from major cancer centers emphasize that any man over 60 experiencing persistent, unexplained bone pain should undergo immediate evaluation for possible prostate cancer metastasis. The evaluation typically includes blood tests, imaging studies, and potentially bone scans to determine whether cancer cells have established themselves in the skeletal system. As we've journeyed through these 7 warning signs together, you've gained crucial knowledge that could literally save your life. Remember, prostate cancer often whispers before it roars. These subtle changes we've discussed are your body's early warning system, giving you the opportunity to take action while treatment options are most effective. The statistics speak for themselves. Prostate cancer is the second most common cancer in men. But when caught early, survival rates exceed 95%. The key is recognizing these warning signs and acting on them promptly. Most of these symptoms have harmless causes, but when they linger for more than a couple of weeks, it's time to book that PSA test and digital rectal exam. Don't let fear or embarrassment prevent you from seeking medical attention. These symptoms aren't just inconveniences to endure. They're valuable information that could guide you toward early detection and successful treatment. Your life, your relationships, and your future depend on taking these signs seriously. Early detection truly keeps treatment simple and survival rates high. The choice is yours. Will you listen to what your body is telling you? If this video was helpful, kindly type "helpful" in the comment. That motivates us to produce more content like this. Please give this video a thumbs up, share it with the men in your life who need to see this information, and subscribe to our channel for more life-saving health content. Thank you for watching, and remember, your health is your most valuable asset. Protect it.